Parental assistance. We are happy, of course, to have with us once again Alvina, epidemiologist with the Florida Department of Health here in Orange County, who will report on important COVID-19 trending and data here in Orange County. We begin with the mayor. Mayor?
All right, good morning. Thank you, Dr. Williamson. We're joined today. We have several of our commissioners here with us, Commissioner Wilson, Commissioner Gomez-Cordero. We also have our medical director, Dr. Christian Zuber, our public safety director, Banks, and our HR director, Ricardo Day, who has joined us. I'm not sure I see our school board representative, but we also have, yes, there he is, Scott Howard from the Orange County Public Schools. And then we have Dr. Yolanda Martinez from our Orange County Health Services who have joined us. As I begin this morning, I want to acknowledge that October is a breast cancer awareness month. And as we move around our county, you may see the Orange County Fire Rescue Department will have one of the engines that will be wrapped in pink. Also, you may see Orange County Corrections staff who will be wearing pink badges and other items this month as well. I bring that up because not long ago, the governor announced the First Lady's diagnosis with breast cancer, and our hearts and prayers certainly go out to the DeSantis family. It just reminds us that we still have significant numbers of women every day who continue to battle with breast cancer throughout our nation and certainly here within Florida and our community. So as we continue to also battle with a public health crisis, we have many, many challenges as a community. I will acknowledge some other things that will be going on during the month of October as well in just a few moments. But I want to transition at this point and talk a little bit about where we stand with fighting the coronavirus here within our community. We continue to work towards that pinnacle of trying to reduce the positivity rate to 5% or below for a sustained period of time. Once we do that, we will have contained the virus within our community. But I have to report that, unfortunately, we continue to see cases across America. We're not unique in our community with the number of cases that we're seeing. Over 700,000 individuals in the U.S. have died of COVID-19. We have 55,000 plus who have died of the disease here within the state of Florida, and 3.58 million COVID cases have occurred here within the state of Florida. As it relates to Orange County, we've seen over 228,000 coronavirus cases reported in our county alone. The number of Orange County residents who have died from COVID-19, sadly I have to report, has now reached 2,045. That's an increase of 45 fatalities since our last briefing this past Friday. The 14-day positivity rate is at 7.67%. That is better news for us because we're getting closer to that 5% pinnacle that we are striving to reach. The percentage of residents ages 12 and over who have received at least one dose of the vaccine is 74%. When we started out, we talked a lot about getting up to that 79, 80%. So as a community, we're getting closer to that. We have some other important updates regarding our vaccine site at Camping World Stadium. Starting this Saturday, October the 9th, our vaccine site will move from Camping World Stadium to Barnett Park. This move is due to events scheduled at the stadium. Vaccines will be available today through Friday, however, at Camping World Stadium. Again, beginning on Saturday, it will be at Barnett Park. There are also changes for the brand of vaccine that will be available. For those people getting their first vaccines, our county site will only offer the Pfizer for the first dose and the Johnson & Johnson one-dose vaccines. The Moderna vaccine will only be available for those people getting their second shots. The Pfizer shot is still available for first, second, and booster shots. For more information, you can go to our website at ocfl.net/vaccines. In our effort to ensure that more of our residents have access in underserved areas, the I Got My Shot vaccine trailer will continue to move across the county. Tomorrow evening, between the hours of 6 p.m. and 8 p.m., the trailer will be at the Walmart Neighborhood Market on Lee Road. Wednesday morning, between the hours of 9:30 a.m. and 11:30 a.m., will be at the Goodwill in Taft. Friday morning, between the hours of 9:30 and 11:30 a.m., will be at the Goodwill in the Waterford Lakes area. And then on Friday, between the hours of 3:30 and 5:30 p.m., at the My Ranchito on Blueford Avenue in Ocoee. Again, you can get more information at ocfl.net/IGotMyShot. In terms of testing, free COVID testing is available at 3 locations in Orange County: Barnett Park and the former Claricona Elementary School, which will be open between the hours of 9 a.m. and 5 p.m. And the Econ Soccer Complex site will be open between the hours of 9 a.m. and 4 p.m. Please note that this Sunday will be the last day the Claricona Elementary School site will open for testing. Again, information regarding testing can be found at ocfl.net/testing. We continue to offer rental assistance for those who are in emergency need of assistance regarding rent payments. We urge our residents to apply to the county's website, and you can also call our 311 line to get information. To date, more than $9.3 million have been approved for distribution. And now let me just talk about, I know many of you have asked some questions about the number of employees who met the vaccine mandate here within Orange County. Just as a reminder, last week on the 30th was the deadline for our employees to comply with our mandate. 87% of all county employees complied with the mandate. 95% of all non-union employees complied, and 77% of union employees. I know that many of you are aware of a potential lawsuit that may be filed against the county by a few of our firefighters. We have not been officially served, but there's approximately 40 firefighters of the 1,300 fire personnel who serve in Orange County, exercising their individual rights in that regard. We'll wait to see what happens if the lawsuit is indeed filed, if we're served with it. But that's a small portion of our fire department. I will tell you, the overwhelming majority of the men and women there did comply with the directive, and they got vaccinated. Across the county, I'm elated that our employees have stepped up to the plate to work collectively to keep our people safe here within Orange County, and to keep their co-workers safe. I believe that, again, that was the right thing to do as public servants, and so we're moving forward in that regard. Also, let me just share with you an update about our redistricting meetings. They are going well. There will be a meeting that will take place this Thursday night at Barnett Park. That meeting will begin at 6:30 p.m. For future meetings, you can go to ocfl.net/redistricting to get information. A list of all of the upcoming meetings are there, and our residents are able to create their own maps to assign districts. This will be utilized as information to make the final recommendations to the Board of County Commission later this year. So the public can provide comment through that process by going to ocfl.net/redistricting. As I also mentioned earlier, October is a busy month, and it's also the month in which we recognize domestic violence awareness. Our Orange County Domestic Violence Commission will launch a new community video message later today. There will be a press conference at the Orange County Sheriff's Office where we will be standing with Harbor House and others, and we will release the video at that time. The video is called Together We Can End Domestic Violence, and it tells personal, heartfelt stories from victims of domestic violence. We are also celebrating Orlando Pride Week. There are multiple events taking place throughout this week. This Saturday, many of our Orange County employees will take part in the most colorful parade that starts at 4 p.m. in downtown Orlando. Of course, the Pride Parade is what is being called the most colorful parade. And we continue to celebrate Hispanic Heritage Month this month, which runs through October the 15th. Our county employees and others are engaged in numerous activities that we'll share more details with you about. And now, as I end my remarks at this time, we'll call on epidemiologist Ms. Alvina Chu from the Florida Department of Health in Orange County for additional details. And Ms. Chu.
Thank you, Mr. Mayor. Thank you. As the mayor previously mentioned, we've had a total of 228,156 positive cases here in Orange County. The 176 new case total for October 3rd was the lowest one-day total since July 5th, 2021 of this year. Our 14-day rolling percent positivity average is down to 7.67%. And just for comparison, in September 3rd, about a month ago, our percent positivity was 15.87%. So we've about halved that now. And this is the 10th consecutive day with the 14-day rolling percent positivity under 10%. Unfortunately, since the last time we met, we have to report a total of 2,045 deaths. The age range was 36 to 91 years old, with a median age of 64 for these new deaths. Our condolences go out to the friends and families of those who have passed. Of those, 19 were female, 26 were male, 2 were Asian, 1 was a native Hawaiian or Pacific Islander, 16 were black, 25 were white, and 1 was other. 15 were Hispanic and 30 were non-Hispanic. 19 have known underlying health conditions and 26 had unknown underlying health conditions. 1 date of death was from May and 1 was from July. 2 dates of death were from August and 41 were from September. The earlier dates of death were previously under state review in Tallahassee, and so those have recently been certified and reported to us. 2 of the 45 deaths, or 4.4%, were reported from a long-term care facility residential address. 3 of the 45, or 6.7%, were fully vaccinated for COVID-19. The median age was 63. The median time between series completion for being fully vaccinated and the positive lab result was about 112 days or about 4 months. 2 of the 45 were partially vaccinated for COVID-19, and both were not past due for their second dose. For vaccinations, 74% of eligible Orange County residents have had at least 1 dose of vaccine, and that includes all the 2-dose series plus the Johnson & Johnson. And 64% of eligible Orange County residents have completed the vaccine series. And as the mayor had mentioned, we do have the I Got My Shot trailer vaccination events coming up this week, which he had previously mentioned, and you can identify all the other sites where the trailer will be this week at ocfl.net. And with that, I will conclude and turn it back over to Mayor Demings.
Okay, we'll open it up for any questions. Just as a reminder, we have various people who here that are able to respond to questions. A microphone will be moving around to those, so if we can wait until the microphone gets to you, we will do it in that orderly fashion. Okay.
Lauren Seabrook, Channel 9. Can you hear me?
We can hear you.
Okay. Mayor, could you give us an update on maybe how the wastewater is looking? We haven't heard about that in a while, and I just wonder if it's showing a continuing decrease the way the others have.
In terms of our wastewater analysis that we're doing to test for the prevalence of the various COVID variants within our community, we are seeing a consistent decline in all 3 of our wastewater treatment facilities. that is consistent with the numbers that you're seeing reported here. To my knowledge, unless Ms. Chu says otherwise, some of the more concerning variants have not been reported at this point in our community through our wastewater treatment facilities. Yeah. Any update about some of the other more concerning variants that's around the world?
No, I don't say otherwise. So the Mu variant is not listed as a variant of interest or concern. The CDC has recently published or created CDC and WHO have created a fourth category for tracking of variants. It's variants being monitored, and Mu is monitored but not of concern here in Orange County or in the United States.
Okay. All right, other questions?
Speaking of the CDC, I don't know if you saw their new holiday guidelines that they put out, asking people to do virtual celebrations, keep your windows open, have a fan to circulate air, host virtual dance parties. I mean, these are getting some interesting responses on some of our morning radio shows that it just makes me wonder, what is your take on this? And for people that are starting to plan for holidays, I mean, are they going to need to be virtual? Are we just going to need to take extra precautions? Can people take this advice seriously when they're asked for virtual dance parties?
So these are the same guidance that were out at the last holiday when we were still in the pandemic. And I think I should, as far as some context goes, we are still in a high level of community transmission. So we are cautiously optimistic with the numbers that have decreased over the last several weeks that we have passed this particular peak of the pandemic. However, the virus is still with us and may potentially be with us for some time. And so hence the encouraging to get the vaccine so that we can get a handle and decrease severe illness, hospitalizations, and deaths. And so these precautions are consistent with the previous precautions that were published. We are always concerned, it's not a new thing to public health that people don't necessarily take public health precautions seriously, but we hope and encourage people to help us get control over this pandemic so that we can at least have a handle and prevent these very preventable hospitalizations and deaths. And so encouraging vaccination and reducing transmission wherever you can. And so whatever you can do or will do will help.
This is Melissa Thomas of Florida National News. This question is for you, Mayor Demings. Obviously, heading into the weekend or over the weekend, we received news that California decided to mandate vaccinations for their students. I just want to get your personal opinion on that.
Here in Florida, we have certain regulatory guidelines that have been established by the governor as well as the commissioner for the Department of Education, and so our school districts are going to have to make decisions whether or not they will comply with those directives or not. Our experience here in Florida is somewhat unique to Florida, but similar to what everyone else is experiencing around the country. And so what I would say is that our schools are certainly supportive of doing what is necessary to protect our children, our students, and our public schools. And there's a mask mandate that remains in place for the schools here within Orange County. And I know we have Scott Howard here who perhaps can respond if there are any new developments, Scott, reference our school district. So I try not to speak for the schools,
Thank you, Mayor. Right now, we're strongly encouraging vaccinations, any of our students that are eligible. We're looking forward to the eligibility of our 5 to 11-year-olds coming hopefully sooner rather than later. And we'll continue to encourage them and have events and try to get those vaccinations. As far as the requirement for vaccines, that would be a state level decision, just like it was in California. And so we would certainly wait for the Commissioner of Education or the Florida Department of Education to make a decision and directive on which direction they would go in as far as that goes. Based on what we've seen on the mask mandate, I highly doubt that that would be the direction that the state would take. I think we would just continue to strongly advocate for our students once eligible for their parents to get it. And for parents to start having those discussions now with their medical providers, with their pediatricians, making sure that they have all the information necessary so they can make the best decision for their child. So thank you for the question. Thank you, Mayor.
We all are encouraged, however, that, perhaps before the end of the year, there will be vaccine available for children under the age of 12. I know that many parents are looking forward to that because they want to protect their children, and that helps in terms of immunizing our entire community against the COVID-19. So in some cases, it's children who spread it to adults or to other children. And so as Ms. Hsu, as well as Mr. Howard indicated, we have masks, we have the vaccine available to those who are eligible. So we encourage people to get it. We have to run through the finish line here. If we relax too soon, then that creates an additional risk of seeing a new surge of the virus within our community, and none of us want that. Okay. All right, other questions or comments?
Lauren Cervantes, WKMG News 6. Mayor Demings, apologies over here. You had mentioned that you had filed a lawsuit regarding the employees being required to get...
No, we didn't file it. Someone is threatening to file a lawsuit against us.
Oh, someone is threatening to file a lawsuit against you. My question was that last week you had responded, your office, you sent a letter to the state. Have you heard back from the state yet?
Yes. We received a copy of some email correspondence. Our local Orlando Sentinel reporter, Steve Hudak, had reached out to the press person in the governor's office, and that person responded to him. And I don't know what to take or make of it. At this point, there has been no formal correspondence from the state to us establishing a fine. We made some decisions here about how we would move forward with our vaccine mandate for our employees here within Orange County. And I've said to you that the county attorney has advised me that we were on solid legal ground to take the action that we have taken. And we'll just have to see whether this ends up in court or not. But a few of our firefighters, what I indicated earlier was that we haven't been officially served with a lawsuit, but we are aware that approximately 40 of our firefighter personnel have secured private counsel independent of the fire union here. We reached agreement last week with our fire union over the vaccine mandate, and so the fire union has taken one position, and of the nearly 1,300 firefighter personnel, approximately 40 of them have received independent private counsel and have asserted that they will be filing a lawsuit against us to essentially stop the mandate, et cetera. But again, our county attorney has advised me that we're on solid legal ground from the state. The state has not instituted any type of penalties at this point. So you can, in terms of the email, I would encourage you to perhaps, through public records requests, we would gladly give you copies of whatever we have as a county, and you can form your own opinions about what that email says or does not say.
Steve Hudak from the Orlando Sentinel. Mr. Mayor, I have a question for you, and then I would like Alvina to clarify something if she could. The question for you, Mr. Mayor, is you just mentioned that we have to run through the finish line. When will we know when we're at the finish line? Because I don't think we're going to get 100% vaccination.
We probably, as a society, will not reach 100%. And I don't believe that any of us ever thought that we would get 100% because some people have medical conditions that will preclude them from getting the vaccine, and some people just will not do it. But clearly the 79, 80% is a great pinnacle to reach for. But more importantly, we look at the rate of transmission, that positivity rate. And when it's 5% or below for a sustained period of time, that is where we really truly want to be. And if you put this into the context of where we were earlier in the summer, we had a sustained period of time as we entered June where we had been below 5% or better for an extended period of time. We want to get back to that point. That's a low rate of transmission. The Centers for Disease Control at that point had similarly placed us in the low category for rate of transmission. Ms. Hsu advised you today that according to the CDC, we still remain as a high rate of transmission. I believe that they'll make some adjustments over time when they see sustain a period of time where our numbers begin to significantly decline. And they're there at the 7.8% or what have you that we are at now. That's a much better number than when we were at 21%. So running through the finish line to me is when we can get just a trickle of cases coming in where it's 3% or below, it's 2% or below, where there's just a trickle of new cases coming in. To me, I think that's where the finish line is for us. As long as we continue to see people who are testing positive, who are getting sick, who are dying, it's still a matter of significant concern to many of us. I went to a funeral this past Saturday, of one of my relatives who died of COVID. And so I know that just like my family, there are other families who are being impacted where they still see family members who are dying, who are seriously ill. We still do have people in intensive care units who are on ventilators with COVID. So until we get past all of that, where it's just a few, it's a trickle, we have not reached the finish line. And so I can't tell you, I don't have the crystal ball to tell you when that will be, but I believe we are trending in the right direction. I am optimistic that before the end of the year, we'll be in a better place than we are today.
The clarification for the points with Alvina are exactly about that high transmission. A couple of weeks ago, we were like 600 per 100,000 cases. Where are we now?
Right, so if we're going to go by the CDC criteria for how they categorize levels of transmission, when we were at the peak, it was greater than 600. So currently, as of yesterday, we're at 114 new cases per 7, so that's the 7-day average. The other metric, besides the incidence rate, is the percent positivity, and we are, for red, it's below 10%. So honestly, since I will be very optimistic that we will move into the next category below, or orange, within the next week or two. And so once we dip below 100, then we will change categories. And so we are optimistic about that part. As far as the finish line that you had mentioned, in the broader context is that we mentioned that we are in a pandemic. And so part of how this affects us is what's happening in the rest of the world.
Okay.
Mayor Demings, I have one last question that was sent in this morning from Ryan Lynch with the Orlando Business Journal for you. What expectation do you have for some additional American Rescue Plan programs?
That's a moving target. We still have American Rescue Plan dollars available, especially those dollars earmarked for emergency rental assistance. And I believe until we expend more of those dollars, the federal government will have to make a decision for all of the metropolitan areas that receive the funding or that's eligible, whether or not to release the additional rounds. And that's based upon, the expenditure of the dollars that we currently have. But I believe that we will continue to see dollars through infrastructure bills and other things that will assist America in recovering. So, okay. All right. With that, let me just say thank you to all of you for joining us today. The next press briefing, I know is probably sad for some of you, but it will be a week from today, October the 11th at 11 a.m. Is the next scheduled press briefing. Now, of course, if there are some emerging issues that come up through our communications division, we will communicate appropriately with you. All right. Thank you for being here.